Good evening, Oriole Nation. Welcome.
Alrighty. We just came back from our board tour of the new facilities. So excited to be able to share that with the rest of the community next Wednesday. What time is that? It's at
Well, for the community, there's a 5 o'clock ribbon cutting ceremony and 5:30 tours start. So they'll go from 5:30 to 7 o'clock. Postcards are going out later this week for all the communities so they can decide whether they want to be here, as well as there's food trucks at night and music right outside. So hopefully we'll get a few people coming through.
very cool.
Mm-hmm.
Yeah, it looks awesome. So
Thank you.
thanks for the tour. And then our next, we'll call the order of our special meeting of Board of Education. Today on Monday, August 12th, we began at 4 p.m. for our walk. So we'll put that on there. So we can just look for a roll call. Ready?
All right, Geckerman.
Here.
Huck.
Here.
Here. Matthew. Here. Humphrey.
Here.
All right, is everyone here today? Public notification of meeting.
So district office, FLC, BAMS, Horace Mann, and the village.
And then do the pledge of allegiance. I want you guys.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right. Our first item is USI health insurance presentation that was in our board packet.
So welcome Alex back from USI. Thank you so much for coming in. We've been, as you all know, as we work through our world and being fiscally responsible too, working with him to try to do our best to be mindful of our whole population, our organization, do the best for our staff, but also be financially sound too. So we've got some different ideas that we're gonna kind of float, your way today as we're moving forward and pushing forward as a self-funded district.
Yeah, thank you.
Yeah.
Good to be back. So I was here late spring to talk about pharmacy. Now we're here to talk about the rest of the health plan. So in your board packets, and I don't know if we're gonna pull up on the screen.
I can do that,
Your
yep.
packets in front of you.
I can do it right here.
What I wanted to walk through this evening was really just a high-level overview of some reporting. How is the district's health plan running, both from the medical and the pharmacy standpoint? Talk about what our budget projections. So being self-funded, we have the ability to set our own premium rates, but obviously we need to do that in a financially responsible way so that we can cover our costs. So we're going to talk about what that looks like. And then I recently met with the administration here to discuss some potential solutions to get this to a much more palatable number. I think to bury the lead here, we're running hot. I mean, claims are continuing to run at a pretty high rate. So how do we both combat that from a financial perspective, but how do we do it in a way that we're not just completely gutting benefits to employees? Because I think that's very important. It's obviously a hard market to attract and retain top talent. We want to continue to do that. So how do we balance those two things? And I think we have a few strategies that do a good job of balancing that. So we'll talk about those and get your feedback. This first page is our dashboard. So it's a high level overview of how claims are running. And I'm not going to go through all the numbers here, but there is a couple things that I wanted to point out. So the first thing is our net costs last year. So claims plus fixed costs were about $4.4 million. And that's right by where that cursor is under the 2023 column there. Our fully insured equivalent, so what you paid in the form of premiums, both the districts and your employees' rates, was about 4.38. So we were running slightly, we paid out more in claims than we took in premium last year. Year to date in 2024, our net costs are 2.4 million and we've taken in 2.1. So we have about 115% loss ratio for the current year. So again, for every dollar we paid in premium, we're paying out $1.15 in claims. So we're continuing to run at a deficit. The other section I want to focus on is the large claimant section. And we break this down based on 50% of your specific deductible level. So just a quick reminder, your specific deductible level is set at $75,000. So for every individual on the health plan, so your employees, their spouses, their children, everyone has a $75,000 deductible. So if I have $100,000 in claims, the district pays the first $75,000, the insurance carrier pays the remainder of that balance. So we always do it at 50% because it's kind of a good threshold to kind of start monitoring individuals as they approach that limit. And last year we had 22 individuals that had more than $37,500 in claims. Year to date, we've had 9. Okay, so we're about on pace to be right about 18. So kind of continuing in that same line there. We had 12 members last year hit our $75,000 deductible, and we were reimbursed from the stop loss carrier about $607,000. So far, we've had 4 members hit the claims, although you'll notice that amount over the specific deductible is very low. It's only at $37,000. So what this means as we kind of look through it month over month, what I want you to be aware of is right now you are paying almost all of the cost of healthcare. We don't, if you have $1 million claim, we're still only responsible for 75,000 of it. So right now we're like stuck in the medium claims level where we're just kind of getting hit with those $50,000 to $60,000 claim thresholds where the district is absorbing the full expense, if that makes sense. And so we're having large claims, but we're not really getting the benefit of the insurance because they haven't hit our deductible level. Does that make sense? Mm-hmm. Okay, if you want to scroll down to the next page. Again, there's a lot of numbers here, and I don't want to bore you to death with all of the numbers, but I do want to point out a few things. The month of April, we're showing 162% loss ratio. If you can just scroll over a little bit more to the right.
Yep.
So you'll see there's in the gold there's a net cost divided by fully insured equivalent. So that is your loss ratio. So how much are we paying out versus how much are we taking in? And you can see the dollar amounts to the column to the right. So in the month of April, we're showing 162% loss ratio. The main thing here with this month specifically is we had about $100,000 in claims that were incurred in 2023, but did not hit our plan until April of this year. And unfortunately, I don't know if you all remember, but last year you had your aggregate insurance, which means every dollar that was being paid out, whether it was small or big, was being paid by the insurance company. That aggregate ended on December 31st. So it started over, even though the claim was incurred last year, we didn't have that same coverage for this year. So I want to point that out because the month of April looks really terrible, but really $100,000 of that is due to claims that were incurred actually in the previous contract year. So that's kind of the bad news. The good news here that we're not showing yet is you'll see column under the paid claims section, RX rebates. And right now that's showing at $0. Beginning in September and then ongoing for a quarterly basis, you will start to receive prescription drug rebates. Currently with your ProAct contract and then moving forward with Smith, those will begin to come on a quarterly basis. That I would guess, given that your prescription drug costs last year were about 1.3 million. If we assume about 20% of that should be coming back in rebates, we should be looking at anywhere between $150,000 and $250,000, hopefully a quarter in prescription drug rebates, which will help offset some of the expenses there. So there's kind of the good and the bad. The last thing I'll say though, if you just want to scroll down a touch, is that loss ratio of 115%. That equals about $327,000 of a deficit. Okay, so that's what we're kind of facing here as we begin to look. This next page is just a summary of your high cost claimants. Again, all I want to point out here is not necessarily the conditions, because I don't think that's important, but really the total paid. We have one claimant at $108,000 this year. That will be someone to keep an eye on just because they've had significant month-over-month claims. Everybody else is looking, not extreme month-over-month claims, but they're right in that 78, 75, 76 threshold, where again, we're not really getting the benefit of the insurance protection, and the district right now is kind of absorbing all of that cost. So just kind of reiterating what I mentioned in the opening.
Alex, can I ask a quick question?
Yeah.
These numbers, the gross cost, or is it effort's been reduced by the contracts that we have. with
Yep,
the
it's what
providers.
was paid, so it's gonna be after network discount and everything.
Okay, thank you.
So this slide, this page is exactly the same as what I just went over, except this is now 2023 data. So you can see how the medical claims and the RX claims have gone on a month-over-month basis. The main thing to point out here is that 101% loss ratio all the way to the right, which showed about a deficit of about 71,000, almost 72,000. So if you add up the 2 years, we're running at about a $400,000 deficit in terms of what was paid out versus what was taken in the form of premiums. Here is your large claim activity. So again, we had 23 members with at least $37,000 in claimants. Those 23 members accounted for about $2 million in costs. So almost half of our overall costs were incurred by these 23 individuals. Any questions so far?
Does that include both medical and prescription?
Yes.
Okay.
Okay, so this is now the projected renewal. And I can go into as much detail as you would like, if you'd like to kind of understand each line here. But what we do is we look at the claims, both medical and RX, and here we do have it split because there are different inflation, or what we call trend rates for each. So in our world, prescription drugs go up about 10.4% year over year. Medical is about 7.4. If you wanted to use a blended trend rate, it's probably about 8.5. So we break it out by medical and RX claims. We take out any rebates or specific deductible reimbursements. So we get a net claim amount. And then we add in trend and we kind of project it forward. And the long story short here, if you want to scroll all the way down to the bottom of this page, is our budget is calling for about a 21.5% increase, which is about $900,000. So essentially, if we did nothing, we just renewed as is, we made no plan design changes, we didn't implement any strategies, we're looking at about a $900,000 increase to benefits. Questions on how that number was calculated?
Did that, is headcount consistent year over year against
close.
that?
Yeah,
Okay.
yeah, in terms of staffing.
Yes. If you look, and I don't know that we need to go back to it, but if you look at the slides where it's month over month, it says total employees. And you're consistent, 2023, your lowest month was 157, your highest month was 166. And in 24, it's dropped a little bit, 152 to 154, but relatively stable.
Okay.
Any other questions? All right, that was the gloom and doom portion. Now we're going to talk about what are we going to do about it to help get this, down more in line. So the first thing, and these strategies work in conjunction. So we're going to go through them individually, but I kind of want you to take a step back and think about this holistically as I go through the remainder of the presentation, because I don't think any of these strategies are going to be implemented as a one-off, but it's important to show you kind of how we came to the math that we did. So the first thing that we wanted to look at is your deductible. Your deductible has been really competitive from a single 500 family 1,000. That is much lower than most of the districts even we work with. I think it's no secret that after Act 10, a lot of districts jacked that up way up right away to increase the savings. I think we, and when I say we, you, the district has done a really good job of maintaining that benefit, because I do think that is a strong attraction and retention tool, but it's well above average in terms of benchmarks. So if we looked at increasing that from 500 to 1,000 single and 1,000 to 2,000 family, in conjunction with increasing the coinsurance. So today you have a coinsurance rate of 5%. That is a very unique benefit. If you were fully insured, we would not be able to offer a 5% coinsurance level. The minimum is generally 10%, and it generally goes in 10% increments. But because you're self-funded, you do have that ability, and UMR is able to administer it that way. But if we got that more in line with the markets, those two changes, and is everybody familiar with what co-insurance is? Okay, so those two changes alone, if you could just scroll over to the right, would save the health plan 6.2%. So that 21.5 is now down to 15.3, roughly speaking. Just those two plan design changes. Okay, so increasing the deductible by 500 or 1,000 single family, and increasing from 5% to 10% due to our utilization, that saves the health plan about 6%.
Is that broken out like by which change? Because usually co-insurance counts for most, right, of that?
These two, that 6% is them in conjunction.
Okay.
When I looked at this, so this is our actuarial tool, and it takes into account how much you're spending per employee per month on costs. And that number was roughly like $810, which is really high. And because utilization is high, we're getting a lot of value for these changes. Even though they're not, I understand to staff, it may, this is impacting their pocketbooks, I get that, but from where I sit, it's not a dramatic change in the grand scheme of plan design changes. Okay, so that's option number one, and it ties into where I'm gonna go with the next strategy. So some background here, we have strategies called tiered network incentives, and if you've dealt with insurance in the past, you may be familiar with like narrow networks, pitting Aurora versus Freighter, or Theta Care versus Aurora, picking individual health systems against each other to improve your network discount on the health plan. That's how it was done a few years ago. It's now getting to the point with data that we can get it down to the individual provider level, the actual doctor level. We can tell which doctors are outperforming other doctors. And in healthcare, when you have better outcomes, you have lower costs. So the goal with any of these programs, and you can see a handful of vendors on here, Surest, Proximal, Garner, et cetera, the goal is to give your employees and their families the data to which doctors are the highest performing doctors within your network. And if they choose the higher performing doctors, we will give them additional benefits. So that's kind of the goal. And if you want to slide down, we're going to talk about one of those vendors in particular, Garner. And this is Garner data. And this is just one area that they've examined. So you'll see up there in the gray, surgical site infections after colon surgeries. So on the left in those big bars, you see hospital A, hospital B, hospital C, et cetera. And what they're showing you is, okay, hospital A has the best surgical site infection rate at about 12%, let's call it. And hospital D is performing the worst at, 18%. What you'll see on the bars to the right is all of those same health systems but broken out by provider. So, you'll see like the top two performing doctors are both at hospital A, but if you go all the way to the right, the second worst performing doctor is also at hospital A. So if we are only funneling people through the health system without accounting for the actual provider, it's a little bit of, luck on which provider you're actually going to get to see when you go see that provider. And you can have drastically different outcomes based on probabilities, based on the actual individual doctor performance. So on the next slide, what we're trying to do, again, is to give your employees and their families access to that data so that they can determine the best level of care. So here is an example of a snapshot. You can do it online or through your phone, and it says, what do you need to see a doctor for? It said lower back pain. They're going to show you doctors within your network who have availability for patients. So one of the biggest concerns we get is, hey, if we're funneling everybody to the top performing doctors, is access to care going to be a problem? Garner is only going to show you doctors who are accepting new patients, and you can see them ranked there, and they have all the things from patient reviews to performance, etc. And if I use Garner, we will reimburse that full amount of the deductible. So I'm going to have you skip 2 slides.
Okay.
This one right here.
This one, are you on?
Yeah.
Okay.
So what we're looking at doing is putting in an HRA, a health reimbursement arrangement. You may remember this from the days when the district was fully insured. We had an HRA in place to reduce employees' deductible limits. The logic then was, most people won't hit their deductibles, and those that do, the district will self-fund it. This is the same concept, but we're now tying it to the data that Garner provides. What we are going to be recommending is that increased column. So you'll see overlay, increased, enhanced at the top. I want to focus on that middle column. So what Garner is projecting, again, based on your actual claims data, is that we can funnel your employees and their staffs to the top 20% of the doctors within your network, your claims cost should decrease by $231 per employee per month. There are fees for this program, so it's a $14 admin fee, and then we have to fund that HRA. So we have to fund the claims mechanism that we're going to be reimbursing, and they have it at $47 PEPM. So you take the 231 minus the 61, and that gets us $170 per employee per month. That reduction in claims cost in total dollars is about $326,000, and that's including our fees that go into it. So what our new plan design would look like, instead of the 500, 1,000, it would actually be 2,000, 4,000. Now the benefit here is if employees get engaged with this program and they use the app and they go to Garner approved doctors, their deductible will be $0. Because we will reimburse the full 2,000 or the full 4,000 family dollar deductible if they get engaged. If they choose not to get engaged, their out-of-pocket's going to go from 500 to 2,000 or from 1,000 to 4,000. So it's quite a dramatic increase, but we want to get people engaged and become consumers of the health plan in order to drive these savings amounts. Any questions on that program? Because it's a lot.
So the projected, can you scroll back up, Matt?
Right here.
Yeah, when you see the 231, that's a reduction in claims cost projected based on you utilizing those doctors.
Yes, so it's based on utilization. That's absolutely correct. And you'll notice there's three options here, and there's dramatically different savings amounts. And the overlay program, for example, is only showing $31,000 in savings. The reason is the incentive isn't there to get employees engaged, so they know if there's not a big financial incentive, people aren't going to change behavior. So we're not going to see the dramatic claims reduction. Where in the enhanced, there's a large increase that would be increasing your deductibles to 3,000, 6,000 with a bigger HRA on the back. That's why they're showing the bigger claim savings, because they expect utilization to go up as the financial incentive gets bigger.
Yeah, okay, so the overlay is effectively not changing the.
You just be putting it on.
Kind of,
Yeah.
okay. Got it.
So I think as a starting point, I would recommend the increased. Wildwood at Fremont School District, who's another client of mine, they just rolled this exact program out on July 1st. It's only a month old, so I don't have a lot of testimonies, but this is something I know Franklin Public Schools down in the Milwaukee area implemented this. They're with a different broker, but this is a tool that a lot of districts are looking at. And the thing I'll say about Garner, because I showed you a couple different vendors, Garner, I think, has the best data to the point where United Healthcare is buying their data. So think about how big United Healthcare is, and they believe in Garner's data so much that they're purchasing it as they evaluate their own networks and their contracts. So I'm very hopeful of this program.
The total expected savings, is that assuming that every employee will use Garner?
They assume 43% of their staff will use it. They know that not everybody is going to use it.
Right.
Do we have any data that would look at doctors that have been used in the recent past compared to where they sit in the Garner platform?
About 30 to 35% of your staff is already seeing likely a Garner. So it's about 65, 70% would, need to make a change.
So those 30 to 35 would be likely in 43% adoption. I mean, provided they don't want to pay a deductible.
Yeah,
And then we're banking on some conversion.
correct.
Okay.
And Alex, just to clarify too, like your general practitioner, when you go in for your annual, what happens, what is that? I mean,
Yeah, so if I go in for my annual physical, remember that's covered at 100%. So one of the first bits of feedback I've gotten from employees is, I don't want to change my primary care doctor. Okay, you don't have to, but what I am gonna ask you to do is if you get referred out for either, you need a knee surgery, you need to go see an oncologist, whatever that next step is, don't just go to the doctor down the hall that they refer you to, pause, get engaged with the app, because honestly, it may be where I go to Aurora for my primary care doctor, and now the best next doctor might be at Freighter or Theta Care or Bellin or wherever it may be. And that's not always easy. I know when I had surgery, I just followed my doctor's referral. I didn't think twice about it. But, we want to, be cognizant of the choices we're making around our healthcare. The other question I always get, and then I'll pause again for questions, is, how far are they gonna make me travel? First, being in a pretty big metro area, I would not expect travel to be more than 15 miles for the majority of your staff. However, my feedback to employees who've asked this question is like, well, are they just gonna send me to Milwaukee? Are they gonna send me to Madison or, Green Bay, whatever it may be? If I knew that that's where the best doctor was, I personally would not mind traveling an hour to seek the best available doctor, especially if it was for one of my children. So if you knew you were going to the best available provider, would you mind? And again, I don't think that's gonna be a problem for the majority of the claims that we're gonna be seeking. Now, if you have someone who needs a brain surgery or heart surgery, those more, highly technical, specialized treatments of care, there may be some drive time involved. But for, an OBGYN to deliver a baby or, a specialist, it's gonna be within a greater Fond du Lac area.
What about emergency care?
So this is not used for ER or urgent care. It's mainly for, the things that are a little bit more planned out. So your primary care, seeing a specialist, surgeries, et cetera. Yeah, if you have an emergency, please don't get on the Garner app.
Yeah.
Just go to the emergency room and get it taken care of.
So is it any doctor that's listed on that Garner app?
Mhm. Yep, and they're gonna show you 4 or 5 choices.
Do you have to, what if you accidentally end up at a Garner doctor just by following your doctor's referral? Will that still qualify for the reimbursed deductible?
As long as you engage in the app.
Okay, so
before
you
the
have to
appointment,
do
yes.
something within the app.
Correct. If you just go, and even if you stumble into one, if you don't engage with the app, they're not gonna know you went there.
Got it.
So you're not gonna get.
Okay.
What's the ease of understanding for the average employee? Are they gonna be confused by all of this?
I mean, I think at open enrollment, it's gonna take some education. We need to explain it and go through it. I do think the app is really easy to understand. I also know that there's gonna be a portion of your population that maybe not the most tech savvy. But hopefully they can learn through it. I mean, there's an app for everything now. And I know people are sick of downloading apps, but we're just trying to create that extra level of consumerism to get them to the best care.
Alex, will they be able to see the doctors before? Like, can they download the Garner app now or at that time?
Not now. They'll be able to see it about a month before we go live on January 1st, because Garner needs to build your population into their system so that they can give everybody a code on how to sign up.
Mhm.
Until then, they won't be able to check if their doctor's in.
And there's no platform outside the app to check that either.
Now, not without going to Garner directly, and they're gonna get pretty mad if I send them 150 doctors to check.
Fair.
Would it be expected if they're already in care to switch?
So if I'm getting, maybe cancer care and I'm in the middle of chemo, I don't think it's fair to expect someone to switch in the middle of that care. Same thing if I'm, 4 months pregnant, I don't think I would expect someone. But, as we get closer to January 1st and the switch is over, if I know I'm having an upcoming knee surgery,
Sure.
I do think it's fair to maybe wait a little bit and check the app and see where the best provider may be. So for those more specialized things, that's gonna be ongoing, I don't think so. But for the more planned things, I think we can.
So would we, in that thought, would we benefit from this savings right away? Because if a lot of our heavy spenders are already with probably extensive care. I mean, is there a conversion rate to that, or is it?
Yeah, well, it'll take a little time to justify. I think the total expected savings is over a 12-month period.
Okay.
Yeah, right away in January, I don't know how much is gonna switch, but, even seeing the best primary care providers, that has downstream effects.
Yeah.
Better early diagnosis, or honestly, lower misdiagnosis, where that, misdiagnosis may lead to a surgical outcome that wasn't necessary. We're hoping that, there may be downstream effects that we never see just by going to the best providers.
I have one more question, is Garner, I don't know much about Garner site, so how does a physician, is it all review based that puts them on there, or is it like?
They have several different data sets. They get their data from Medicare, Medicaid, the individual insurance providers, so Anthem, United Healthcare. So they feed it all into their algorithm, and it spits out a score based on outcomes. You don't look convinced.
Well, no, I'm just wondering if it's just one solo thing, like they've saved the insurance companies money in the past, probably because, I don't know, it could be because they did a better job with whatever the thing was, but, there's a lot of other factors that go into what people are comfortable with a doctor, or how good they are, I guess. Maybe in certain situations, seeing the doctor 3 times instead of once is better care. But, those kind of things make me wonder, I guess. But, and I guess too, even accepting new patients, why are they available? Wouldn't the best doctors probably be filled and not accepting patients?
So yes, it's always a sliding scale that we're sending you to the top 20% of available doctors. So to your point, the very best doctor may not have availability. But of the doctors that are available, can we get you to the best ones that are accepting patients? So it's always a little bit of a sliding scale.
Sure.
So what numbers do you have baked into the latest projection that you sent out for the referendum?
I have a decrease of $250,000 in 24-25 because it's only gonna be half of a year, and then $500,000 decrease every year thereafter, so that we can build up our reserves. The savings, if all goes as planned and there's more that we're gonna talk about as well. This is like tool number 2 out of a few. So we're gonna talk about more, but I put in $500,000 savings from what I had originally budgeted, which was a 15% increase.
So this takes out 326 out of the 900.
And then the other deductible switch that I talked about was another $250,000 in savings. So I think if you took all of those savings at face value, it was about a 7.2% increase that would have been needed for next year. To Maria's point though, we've been running at a deficit the last year and a half. We need to build in some reserves so that we're not having these giant kind of fluctuations with the health plan, which is why we're recommending an 11% increase. And that $167,000 in reduction from the original budget number you see there was because the original budget was showing a 15% increase, correct?
Correct.
You had mentioned, what was it, 150, 250 per quarter, was that for the RX piece? Or was that for the year?
That'll be per quarter. It's gonna be based on utilization, so that number will fluctuate. But I would expect that number to help offset some of those costs as well.
So on the one page up above where we first talked about deductible, we had the family going from 1,000 to 2,000. But that's really going to
4,000.
4,000, but the single stays at 5.
Well, the single will go up to 2,000. because we were talking about increasing it from 500 to 1,000, and then the Garner program would increase it further to 2,000. So it'd be a $2,000, $4,000 deductible. That's what your plan design would look like. And then if employees engage with the Garner program, it would be $0.
Okay, because on this, the recommendation side, it says 500 to 1,000.
Yes, and then the Garner program would be added on top of that. So I probably,
So the family would be 4,000 with the
single would be 2,000.
2,000.
So, and then you had mentioned, with Garner, if I go to one of those preferred 20%, it doesn't have to be the top one, it just has to be one of them that are listed.
Correct.
And then that piece of that deductible would be reimbursed.
Correct.
So they pay up front, then is that, or is it? from a
So the
district?
patient would pay and then get reimbursed from Garner. There is like a 6 to 8 week lag time.
Sure.
So employees could also wait to get reimbursed and then pay once the reimbursement comes in. I know some people don't like doing that. If they have outstanding bills, it gives them anxiety, and I understand that. So they would have either way. The other thing with Garner, if I go and see a Garner doc and that doctor writes me a prescription, the Garner HRA will also cover their copays for their prescription drugs. So really the only expense they would have would be their co-insurance amount if they hit their deductible.
And do they, as a patient, have to, other than picking and using Garner to say, hey, I wanna go with this doctor, for that billing piece, is there a lot of, is that,
It should be smooth. I'm not gonna say it's always gonna be perfect,
Yeah.
because there's always administration blips. But if I download with the Garner app, or I log in, book my appointment through Garner, once I have that appointment, the claim should just run right through.
run through them? Okay.
Not having to take an extra step and call.
Shouldn't have to. I would always encourage employees to keep their explanation
Yeah.
benefits and everything else, because there's going to be hiccups, there always are, but for the most part, I'm hoping that it's really seamless.
And then last question, when we get to the the deductible, our co-insurance goes to 90/10 then, right? Does that 10 still get covered if I go through Garner, or is
No,
it?
they would have to cover that. That's their-
Now, so the doctors have to agree to be part of the Garner setup?
No. So they are going to look at your entire Choice Plus network. So if you're, and this works if I'm in Fond du Lac, if I'm in Oregon, if I'm, if I have an adult dependent going to school somewhere, it works everywhere. Everywhere within your network.
So what's 11% cost the employee on the insurance increase?
I didn't do that math. I can find out where we're at right now, and then an 11% increase.
Alex, is there anything else in this that you want to share out right now that we can,
If you just want to go one slide up, I do want to bring it to the board.
this one right here?
Yeah.
Okay.
I do want to bring it to the board's attention. This is an initiative that we would like to also start in 2025, although it has no budget impact for the next 12 months. But as part of a wellness incentive, is probably the best way to describe it, USI has found through our book of business, and we have over 3 million members that work with USI, so 300 employees across the country that work with consultants throughout all 50 states. We have found that the best way to create a return on investment, if you will, which I don't like that term, but the best way to lower claims costs with a wellness program is a simple primary care physician engagement strategy. So you can see all the stats on here. Inpatient admissions go down 30%, ER visits go down 8%, hospital readmissions go down 60%, average length of stay goes down 16% just by having that annual physical. And again, if we're doing it in conjunction with Garner to get people to the best primary care physicians that they can see, we're really hoping that that can help catch things earlier. And when you catch things earlier, you get better outcomes and it's less expensive. So keeping your population healthy. So what we would like to implement beginning in 2025 is that all employees and spouses, we cannot do it with dependents due to different laws, but for your employees who are on the health plan, and if they have a spouse on the health plan, we would require them to get an annual physical with their primary care provider. And if they choose not to, within that 12-month period, their premiums would increase from 12% to 24%.
Mhm.
I want to make sure I got those numbers right.
Mhm.
So essentially, it's a 12% differential if they choose not to see a primary care doctor. So all they have to do, the district's not going to get any of the information on how that visit went. We're just going to get a signed affidavit saying, Alex went to the doctor, had his age, gender appropriate physical, and then I would get the normal 12% rate. If I don't do that, I pay 24%. So again,
Where did the 12% come from?
that's what your employees are paying today
12% of the total premium.
of the total premium.
And we have done that before. We've done that incentive before, but it was with biometric screening, where we said you're on premium level 1. If you choose to not do the biometric screening, then you would go to premium level 2, which is double the premium. And we had 100% participation because people didn't want to pay that double premium.
So they're paying 12% now, and that's what's gonna go up by 11%.
Right.
So how do you, you have all year to get your physical set up, so when does the change in rate, just say, hey, I signed me up for the 12% and trust me, I'll get there, or what?
So, and that's why I said there would be no financial impact for
Okay,
next
so you
year.
do
So
the
you,
first-
the first year, everybody has a year to get it done. We
Got
would
it.
probably roll this out November 1st of 25. They would have until October 31st because we need to have some admin time to load the rates and things like that. But you're giving everybody a 12-month period. And then if they turn it in, their rates would not be impacted until 2026. So there's no budgetary impact to this program in year 1, but long-term, if we get folks engaged, we hope their claims come down, and if they don't, it would help the district financially because they're gonna pay a higher premium percentage. So the 3 strategies that we're kind of bringing to you are the plan design change, the implementation of Garner, and the physician engagement program. The other thing is the move to Smith RX. We are being very conservative with that, so that move is not reflected in any of these changes either. Again, I think we want to be very conservative with our numbers because while we know there's a big budget impact here, we also need to build the reserves in that self-funded health plan up. So kind of putting that all together, that's what we're looking to do for January 1st of 2025.
Do you want to talk a little bit about family savings plan too and how we're,
Yes, so this is a program you already have in place today. I don't know if you remember, but family savings plan is if I have a spouse who's also working and that spouse has access to health insurance through that employer, the district today has an incentive where if I go on that health plan, we will cover all of their out-of-pocket expenses on the health plan. So we'll cover their deductible, their co-insurance, their co-pays, et cetera. So that member, your employee and their families would have essentially free healthcare coverage outside of the premiums they'd have to pay to be on that health plan. It's, the way I describe it, it's the world's nicest carve out. We're saying, hey, if you have access to this benefit and if you can take it, we will cover all of your out-of-pocket expenses. So we have that today. It's very low utilized, I think 12, 15 members.
yeah, it is very low.
Out of your 160 population. Currently today, you have about 100 family plans. So what we're doing over the next few weeks when teachers begin to come back to school is we're gonna ask everyone who has a spouse on the health plan to meet with Network Health and Family Savings Plan to just figure out if this plan is a better benefit for you. Again, I think if we can shift some of the risk to other health plans, it would help. And also for the members that maybe have some significant health issues, this would be, in my opinion, a no-brainer because now I'm having all of my out-of-pocket expenses covered through this HRA of the district. So the district wins because we're moving that risk off of our health plan, and the member wins because they're getting all of their out-of-pocket expenses covered. So that is another program. We're already doing it today. We're just trying to rebump that program up, make sure your staff are aware of it and how it works, and give them a choice. We're not forcing anybody to do it, but if it makes sense for them and their families, we're going to have them meet with people.
On the reverse side, if a spouse has access to insurance, we still let that spouse on our insurance if they want to.
Yes,
A lot of places don't do that, right?
right.
Right. A lot of places don't. I would say there are very few school districts that have a carve-out strategy. I think I can think of maybe one in the entire state.
No one is wanting to pull that trigger yet.
Well, and demographically, it's such a family-oriented place. Not a lot of districts want to, carve out spouses or, make the children go on a different plan. So that's why I said this is a way of doing it, but it's an added benefit as opposed to taking something away.
I guess I'd like to see a sheet, on the impact on the employees, if you add all this up and, what it means, what does 11% cost? What are the different deductibles and co-pays, and just, I don't have a sense yet exactly what this would cost an employee.
And that's fair. I think it's really fair. Absolutely. Just 20,000 feet, with Alex coming in and just seeing some of these things and these changes and looking at our potential debt within those areas, we had to be creative and think about how can we maneuver and make this happen. I think a lot of these suggestions, and we've been fortunate enough to have more conversations with Alex, I feel like this is, the next best step that we can make happen, still considering our staff in the process, at the same time also reducing, some of these fees that we're just getting tagged with that could be eliminated. So, and then with any change, there is always, learning and understanding and walking through some different things, but for the grand scope of things, in terms of keeping us financially sound in the years to come, this is, I think a pretty good recommendation moving forward.
Well, I think we also have to look at how does it compete with other school districts in our area, right?
Right.
Are we still pretty solid?
Alex, what would you say in comparison?
I would think that if we move to the 2,000, 4,000, 10% co-insurance plan, that's probably going to be right in line. I'd say you'd be in the median. You're not going to be super above average. You're not definitely going to be below average. I think there's, again, a lot of districts went to the high deductible health plans, HSA type plans right after Act 10. And we're seeing a lot of districts try and get away from that because some of the lower income staff at those districts can't afford a $4,000 deductible. That's out of pocket right away in January if I have a significant claim. That being said, when you stack the Garner program on top of it, if I have a $0 deductible, that is still a really nice benefit. And yes, we're asking staff to take another step, but I'm hoping that they're receptive to that because it's still that's a really nice benefit. So we're reducing costs but increasing the benefits, which we don't normally get to do. Most of the time, you get a bad renewal, and it's how can we shift the burden onto the staff, and we're really not trying to do that here.
Yeah, I think it also, what's interesting about it is you're giving them information about, it can be stressful, right, who is the best doctor? How do I find the best doctor? And are they covered? Well, right there, you would be able to say all of those things at once.
And is that admin fee for Garner not like an entry first year fee, or is it?
That's
I mean, obviously inflation's gonna change that once in a while, but.
Right, that's what they collect to run the program. So $14 is to cover their admin costs, their profit, et cetera. The other piece, the HRA, that's the flexible piece, that's gonna depend on claims.
Do the nurse practitioners and the PAs that funnel from a doctor, are they included in the Garner thing too? Because a lot of people are, that are healthcare, and what I've learned is adjusting and changing where there's different tiers now where they're gonna have you just see that person first for this.
Yes, it is.
Okay.
So just to back up, for the single plan, currently that is $143.92
Per month or?
per month. And that would, 11% increase would be $15.83 per month.
In addition to the 143, right? Is that what you're saying? So
Yeah,
15 plus.
Yeah.
Yep.
And then the family plan is $316.73. And 11% on that would be $34.84.
Do we deduct that once a month or both?
Once a month.
Okay.
Mhm.
Any reason why we don't split that for each check?
I don't know,
One,
it's,
Just the way it kind of happens.
well, one reason if you do it per pay period, depending on when the pay periods last, it may be easier to do it on one because you just get that monthly amount. Or if you do it over two, it may not always add up. You might have two pay periods 1 month and 3 another month. So I'm guessing that's why it was set up. But
yeah, it was set up that way and never questioned, but that's a good question.
Yeah, I mean, we just pay them twice a month, every month, so there's no extra month
Right.
paycheck in there 3 times or whatever this point. But I'm just curious about that.
Yeah,
But teachers have the option to either get paid 19 periods or 24 periods.
20 or 24, yep.
So that's part of it too.
Yeah, that's by law.
Mhm.
Do we have anybody that does the 20?
We had one this past year.
Oh, yeah, that's-
So $180 a year for a single and 4 a week. And
What's the timeline for deciding? Do we have time to?
We have time, definitely. So the Smith RX move, that's coming, that's gonna be effective here September 1st. The other options, I think we have some time. I think we would like to do open enrollment, likely end of October, early November. I don't know if we've talked about that yet.
We've typically done it so that everything's in before Thanksgiving break,
Yeah,
so.
so probably make final decisions next month in September. The other piece that is still outstanding is we don't have stop loss insurance quotes back, and we likely won't have those until September, October. That's a small piece of the budget, but that is still outstanding. That's not finalized yet.
This does play into the ask though,
It
to
does.
the public, so it's kind of time, we need to do something in this area. It just depends on like what that is, because, if this is the move, then I think Maria's got us in a decent space for meeting that within the ask.
Mhm.
If we go less than what that is, then we need to determine, do we need to raise that ask to a different level? And that could get a little bit more with what we're having. So, and then that all comes into the next conversation about like what that ask is and how much, just like we've talked about, like how much we want that levy raising or how much is that going to be per, month. So all those things come into factor when we're thinking about this. I think we have to forecast and just say, yeah, there is going to be something we're going to have to do with insurance at this point in time, just what we've come out with. And again, like we've looked at this quite a bit. I think we could find some really good things out of this. I think it's fair and it hits both those angles still. Is it a change? Absolutely. But I think it really knocks out a big chunk of what we're doing. And I think it sets us up right for the upcoming years moving forward here. Not so we don't have to keep doing things like this in the years to come. It's starting this foundation so we can build on it. So yeah, we can bring it back. I mean, we're gonna have to bring it back because we're gonna get, at some time a vote for that, with the crew here. I mean, be it at the end of August or September, or whatever we want to do. But if you need more information from us or Alex, let us know so we can best provide that, but then get that on new business at some point in time so we can move forward with some of this as well. Fair?
Yeah, that's fair.
Is there, to that point, is there anything else maybe you're hearing from other employers or your own places of work? Is there anything else that you want us to evaluate?
I mean, I've always been a big fan of the HSA plans, but I understand that that's maybe something we've already looked at in the past or whatever, so.
We could certainly price that out. That wouldn't be all that much work. What I would be a little nervous about is right now, moving to an HSA plan from the district's point of view is going to look really advantageous because in HSA plan, everything applies to the deductible. And again, given your current utilization, it's going to be almost a complete cost shift to the employee. Now, and what I would also be worried about is adverse selection. If we dual choice it, the employees who don't have as much claims would take that plan, pay the lower premium, and the people who have claims are going to stick to the PPO plan. And then the PPO plan is going to look really terrible and the HSA plan is going to look really well. And all we've done is lower the amount of premium that we're taking. That would be my main concern. So we'd have to price it really appropriately and figure out what those deductibles would, what that threshold would be, because otherwise we could just be digging ourselves in the deep.
Yeah, good point.
But I can certainly run the numbers if you'd like to see it.
Yeah, I'm not saying that, I don't know. I think what we've seen looks pretty competitive and everything, so.
So I guess just letting us know, you know, do you want to see more between this time and that? And then, you know, figuring out what's that time to put it on new business so we can move forward with this, because the sooner we know, the better we can start planning, start having that narrative conversation with staff, other things like that. So we can make this transition doable and like full of information. So people, even though within the change, they're comforted within that too, to make those moves.
So just one more thing. We saw that we had about 800,000 to try to cover, right? And Maria, you built the budget based on 500.
I'm sorry, one more time.
Oh.
The 800,
So 900? Okay, so there was 900 that we had to try to cover,
oh, yes,
and you built the budget based on recouping 500?
yes.
So is there any, I'm just trying to think about like the staging, like the last one, you know, the insurance premiums, would that be something that we consider in 2025 or 2020, you know what I mean? Like, so we're not doing a lot of different changes all at once. I'm just thinking about the timing of it, and as opposed to, we built this budget in our ask with a certain amount in mind. We kind of cover it with the first two programs. Do we need to do the third, or should we, I don't know if I'm making any sense here.
So we need to do the third because the third has a 12-month lag time.
I'm sorry, the
Are
third
you talking about the
being,
physician engagement program?
no, I was actually talking about the insurance premiums.
Oh, yes, that also needs to go up at the same time.
Okay,
Otherwise, we can't do a 0% increase even with those changes. We'd be at least 8 percentage points below where we need to be from a claims perspective.
okay. All right, well, that's good to understand. I thought it was kind of like additive and just keep layering it.
Now it's all
Yeah.
one big
Baked into
package.
one package, okay.
Because to put it a different way, even with the other programs like the deductible or the Garner piece, if we chose not to implement those, that changes that 11% number also.
Right, yeah, that makes sense. It would have to go up to cover,
The savings that we're getting
Right.
from it.
okay.
Well, I hate to see the, you know, the great package that we've always given our employees continue to get changed, but it's a fact of life. I think they're all intelligent enough to understand that they have had a Cadillac plan, basically, if you want to use that term for lack of a better word, and that they know us friends and associates and spouses have, you know, a lot more cost and investment. And that things have to change. We're talking about referendum to cover our costs and, you know, so I think we can send that message. And then what I like about that part of it though is with the Garner opportunity for them, if they really feel they need to, you know, cut their costs, they can pursue that. It's hard to change a doctor that you like or you want to stick with, and so you have that option too, to stay with them if you want, so.
That's a really key point in employee meetings that I want to reiterate here is we're not excluding anybody's doctor. People are still gonna have the choice. It's just you might have a different cost point on seeing that doctor. So we're not narrowing the network. We're not excluding any providers. We're just giving people access to data and choices.
And when you mean cost point, you meant the
Different
governor.
deductibles.
Yeah.
Well, I guess as a start, if we had it on the regular meeting agenda at the end of August, I'd be ready to, to go forward with a discussion, make sure that I understand everything again, and, I think the bottom line is what Matt said, is something has to be done. This expense is just out of whack.
Yeah, if we could just get that sheet, and I'd be willing to move. To that August meeting.
Some board members think they want more time, and we can still do it in September. I'm okay with that too, but if we're gonna move it in a certain way and we all tend to agree, then we might as well get going.
Yeah, I'd be ready in August.
Yeah, I guess unless we can identify something we learned between August and September,
Sure.
that we haven't asked for anything, so I don't know what else other.
Right.
We'll have.
Yeah.
Thank you, Alex. Appreciate you coming in and sharing.
That was a lot of work here.
Thank you.
Joe, patiently waiting for almost 2 hours. Like, this guy is like,
Oh, it's okay. It's important.
he is the winner tonight. Talking about Johnson Bus, Joe's from Johnson Bus. Some of you might have seen him before here at a couple of years back, just, working through the contract.
Yep.
He's going to talk a little bit about that, where we're at, and some of the movements we made there too. Like, so we're moving from insurance now transportation. How does that look? Where are we on that full scale? And just showing you some of that shifts. So, Joe, I'll have you take over for a little bit, and then I'll fill in too to help you out along the way. Okay.
Yeah, thanks everyone. I'm Joe Minton, Vice President of Operations with Johnson. So obviously, we've met with the district. There's an intention to go to a single bell schedule. When you go to a single bell schedule, obviously greatly can impact your transportation. We've gone to a single bell schedule in 3 districts over the last 4 years. One thing I'll say right off the bat is this is the earliest we had a conversation with the district regarding it, and I think it's provided the best outcomes. So that's great. Thanks to your administrative team. In one example, we had 100% increase. We went from 4 double routes to 8 single routes. And what we're projecting right now, for a little background, we call a double route is when we, in the morning and the afternoon, we pick up students, take them to the school, go back and pick up students, bring them to the school. So that's 2 runs essentially, right? And so now we'll be doing it all on one run. We last year ran, and I've got the note here, it was 5 regular ed double runs, 2 special ed double runs, and then 2 parochial double runs. What we're projecting for this upcoming year, right now, we have it tentatively set at 7 regular education runs. We're hoping to get that number down to 6. I don't want to promise 6 and then have to bring you a 7th route, especially when you guys are budgeting, and obviously.
Those are single, right? 7 is single.
Yeah, well, so, they'll all be single routes. We're kind of right on the cusp right now. A lot of it will just depend on last minute registrations, and any other efficiencies we can find in our routing, but we're working as best we can to get that down to 6. So 6 regular ed routes and 3 special ed routes. One of them will be a bus, and then 2 of them are vans. So that's your Amity run and your fundamentals runs. Those are specialty schools that we transport students to. So essentially 9 total runs. And again, if you do the quick math, last year we did 10 total runs. And then last year we did 9. So really it's just an increase of, net increase of 1 run. And I'm sure you're wondering, well, how is that possible? The main reason that's possible, again, is the work that your administrative team did in assisting us in cleaning up the ridership numbers. Obviously, there's set parameters, but over the course of years and years and years, there are a lot of times special arrangements that potentially a principal or an administrator may have asked of us, or families that may be grandfathered in to ride that are outside of transportation boundaries. We've eliminated some of the parochial transportation. And then again, because we received the communication really early and started this process really early with the district, we were able to take apart the routes very early and find some routing efficiencies as well. These are going to be longer routes. You know, they're all looking to be an hour to hour 15, I'd say tops, especially at the start of the year. But that's normal for fuller capacity routes. Let's see, what else?
Do we know the time they were last year?
Or I would say closer to 35 to 40 minutes. Let's see, what else? And then one piece we do want to note, I guess you guys can consider it a hometown discount that you're receiving. When we look at the total vehicle count, so last year, we really should have been billing it as 5 regular education routes, 2 parochial routes, and 3 special education routes, because there are actually 3 unique vehicles that were going out. It just got, the 3rd vehicle ended up getting billed as a double route. So your primary route is where the bulk of the cost comes, and then your secondary route, let's call it a $300 route. Your primary route is going to be $250. Your secondary route is going to be $50. The reason for that is the way, and it's standard across all transportation companies, the capital investment is in that primary route because that's the vehicle cost, right? So anything additional, that's where we can partner and look to. Anything we can build upon an existing vehicle is also cost savings for us. So, but anyway, so we're really proud of the work that we've done. We're really proud of the work that the administrative team has done in partnering with us. So again, we're not coming to you today to say, you know, it's going to be a 100% increase, because there was the potential. I don't think it was ever going to be a 100% increase here, just due to the layout of this district, right? This isn't some large rural district that we're dealing with. You know, it's a pretty small footprint overall, but there was some concern initially that we may have been looking at 7 to 8 regular ed home to school routes and doubling the special ed from the single bus we ran last year to having to run 2 or 3 buses this year. We invested in a larger wheelchair vehicle ourselves, and obviously we required additional capital. With those additional capital costs, there is going to be an increase in the route rates. And when I say the route rates, that's just looking at the single route itself. So last year, the cost for a double route was somewhere around $297. This year, what we're proposing, and I don't know, did you share the?
No, I did not. No, I did not. Go ahead. No.
Yeah.
Yep.
So the cost this year, the net cost for you as a district will actually go down just slightly when it comes to the regular ed routes. It'll go to $293.07. Same for the special education routes, that'll be $293.07. Vans will be $297, and then parochials, if we were to run them, again, at this point, we're not Running any parochial routes would be $293.07. So our ask of the district would be obviously to approve that route or that rate change, as well as some language looking for an extension really through the years 2030 to 2031. And then just making a slight increase to our out years of our contract. So looking at the years 2025 and beyond, just changing our annual increase language to be 3% minimum or CPI plus 1%. So whichever would be greater. So those would be, that is how we've offset the increased capital of acquiring 2 additional vehicles and potentially an additional van to have as a standby spare van vehicle.
So just some more history behind this. When we went to last few years, it was double route. Like, so we had that gap between the high school students would get dropped off, and then 45 minutes later, the elementary would actually get home. So there's this big gap. So what we wanted to do is reduce that and like kids getting home at a similar size. And then we could also have a start time that was similar, an end time that was similar to each, because we had kids here till 3:45 every day. And just looking at the whole scope of it. This summer, as Joe's talking about, our secretaries and others like went through the entire list of riders that we've had in the past. And to be honest, we never looked at that. And I don't know if we just didn't know what we didn't know, but it was something that we just, went through, really heavily and make sure that we had the right riders in there. Our secretaries were calling people, emailing people, hey, if you're riding the bus, let us know, kind of reapplying to ride the bus again. And we kicked this out before the end of the school year, just saying, hey, if you can ride the bus, please let us know. Even after that, though, we obviously didn't get everything back because it is what it is, and we have to just keep cleaning the toilets and try to get those requests back in. In doing so, though, there were a lot of individuals who were open enrolled riding our buses. There were a lot of individuals who were we're not necessarily in a bus route, but I'm gonna go to my friend's house and we're gonna ride with you. All those things were add-ons to the numbers that we had, where we were probably getting way more buses than we probably needed at that point in time because of some of those things that had never been cleaned up. So we're at the point now where we're cleaning this up. The hard conversation, though, is for the folks who had been riding our buses, who are open enrolled or tagging into another person's house. And I've had one just today, in terms of just saying, hey, look, you're out of the district lines and you're open enrolled. We don't provide that. And I'm sorry, this is what this is. This is where we're at right now. So we have gotten some of that. You might hear some of that too in passing. The only other one is the parochial setting too, is, I went back, I talked to the president of St. Mary Springs back on June 20th, let her know, hey, look, this is where we're going. And we still got a little kickback just recently because, there wasn't communication given to those 2 families that were really needed at a $45,000, basically cut that we're saving from that. So there's been a lot of legwork along the way. We're still keeping enough gap here though, because we might have kids who come in that at open house saying, hey, I haven't registered yet, and we didn't know that. We got to make sure we have enough for that. Our elementary students and our high school students and our middle school students will all ride that same bus. There'll be a front and a back, so we'll have elementary students in front, which will have seating assignments. The back of high school and middle school will not. They'll be coming in, and we're going to start that way and see how that works. But it is a little change up from what we've been doing in the past. But even though we've added, we're really same or similar to what our count is. If we can get that down to 6, we're right on the money with what we paid this year, which is crazy in terms of what we're doing. Obviously, we're extending the contract here though too a little bit, but long term, I think we're in a better place.
Well, and it's a smart hedge right now. I mean, I can tell you, we just secured 3 existing contracts, but they were at a 45%, 33.7%, and a 25% increase. Extending with essentially 3% or CPI plus 1% through 2030, 2031 is going to set the district up in a really good position. I don't see maintenance costs. I definitely don't see capital costs. Bus that cost us $100,000 3 years ago is well over $150,000 right now. I don't see those capital costs coming down anytime soon. Our maintenance costs are up, over 60%. And again, we're winning those. Those are winning contract bids, right? Those are winning RFP bids at 45, 30, and 25%. So again, no district wants to see that extending out through, essentially, I think it would be through 29, and then 29 and 30 would be option years, right? They'd be mutually agreed upon option years. Hopefully our service is still, I consider it a contract through 2031. We'd want to continue, and hopefully our service is such that you'd obviously want to continue as well. But it helps us spread that capital cost out over the duration of those years, rather than, if we only want to agree through 27 or 28, we have to recoup the capital cost of 2 for sure, but potentially 3 vehicles, that we had to purchase in short order. Any other questions from the?
I have a couple. The first is, can we legally do more than a 3-year contract? Is there some types possible restrictions with public entities?
Yes, you can, because it would be essentially it would be an extension off the current contract. So yes, you can. Again, I'm not a legal expert, but we have that. We have evergreen contract language with many of our districts as well. That we have a contract with one of our districts that's typewritten from 1989. That's just continually. They probably have the best rates in the state, right? Because they just have a CPI increase every single year since 1993. So you can, but again, not a legal expert.
So there's like a series of 3-year contracts?
It can go up to 5. So you can do 3, and then you can put 1-year options in there as well.
Okay. Yeah, and that's fine as long as it's legal. And the other question, what about drivers? It's been a continual problem in recent years. How are you doing on that?
We're doing well, and again, that's why, we're just as invested in trying to keep that total route number down. More routes means more drivers, and it means more buses. And to be honest, right now, buses are even harder to find than drivers. But we've done a great job with our recruiting and our staffing. We're presently projected to have our entire office team and our maintenance team off of a route, which in some of our locations, we can't say the same. We have, anyone and everyone in the building is out driving a bus. So right now we're projected to have several drivers available as standby and available to help. The other thing that helps with going to the single route is it can allow for us to better meet those co-curricular requests. One thing that we've done better than most, obviously there's been some adjustments in co-curricular leave time, and the district has done a fantastic job partnering with us and moving some of those, is that we haven't had to say no. Many of our competitors have said no. They've set guidelines that districts can't have field trips that leave during route time, or can't have co-curriculars that leave during route time, or some of our competitors have just gone to their districts and said that parents will have to drive X, Y, Z sport. We haven't done that. We're better positioned than most, but we understand that that can change at the drop of a hat. So if anyone in the room is interested in getting licensed, we do provide the training, and we provide a sign-on bonus and competitive pay. So we're always taking applications too.
I will have to say, like Joe and his team, like whenever we ask for a meeting, they're coming in. Ken's position, what is his title?
He's our regional vice president.
Yeah, so he comes in every single meeting with Joe and Shelley, who's our main person in this area to help, routes go. And I don't know, we've had quite a few meetings in the good way because a lot of it, there was so much uncertainty when I first started, and now over that time have established some really good relationships. We have our principals in on those meetings too, so they can have those share outs and discussions on what their perspectives are. We're actually this week bringing in bus drivers to have lunch with us, talking about like, what does that look like as far as expectations from our language from the schools, so that when they leave here, they're getting that same thing on the buses too, as best as we possibly can. So we meet that as well. So there's been some really good, I think, movement in the last year and a half with this work.
Yeah, a little bit of backstory there, and it's frustrating that happened, and the Fond du Lac district and North Fond du Lac district felt the pain from it. But the reason we had a bit of a service interruption 2 years ago was we took on Rosendale Brandon School District contract, and we're running that out of our Fond du Lac district. It is a benefit to this district and to North Fond du Lac because, economies of scale, having being able to run more contracts with less overhead at one location allows us to have much more competitive pricing. But when we acquired that contract, many of the drivers decided not to come over. So it's a 10-route contract. We started the year with 4 drivers from that contract. So we were piecing things together left and right. We're at a full complement of drivers there, full complement of drivers in Fond du Lac, and full complement of drivers here in North Fond du Lac presently. So we anticipate that that'll continue to improve. And that's one of the reasons that we're able to focus on the customer service side of it and having those conversations and improving the customer service that our drivers provide. Over the last 3 or 4 years, our focus has just been on how do we survive today? How do we survive tomorrow? How do we recruit? How do we meet the customer's needs? Now we're able to really start to focus on, how do we exceed those needs? How do we make sure that when there's a rain out that we have a driver available, at the last second for a change? How do we make sure that students and parents are, comfortable with being on the bus, what's going on in the bus, and making sure that our principals are comfortable with the drivers and the interactions that they have. And so we're excited to be able to kind of take that next step in terms of, again, providing a better level of service and better communication with the students and the school as well.
I've never had issues with long contracts with good partners. And so if you guys tell us they're a good partner, I've got no issue.
So what we'll do is put that contract on the next meeting so that I just wanted you guys to hear this. Joe is available this time. So if there's any other questions that you have from now until that time, we'll put that on new business and you're set to go with it because school's here. So it'll be right before that. Making that happen, but the contract looks good. We'll share that with you too, so you can see it as well. Kind of a breakdown.
All right. Thanks, everyone.
Thanks, Joe. Thanks for your
Take
patience.
care.
Yeah, appreciate it.
Yeah.
Anytime. Thank you.
Take care. All right. Sorry, you get to.
Go ahead. All right, our next item is discuss ballot determination.
So if y'all, I gave you a handout. This is draft. Number one, the top part of this, and we're not getting into too much conversation about this time, but like obviously the 26th, we have to make that vote moving forward with how the actual ballot question looks. We've been working with Quarles and Brady, and they've started putting some things together for us, so we're pretty good this way. But what I want to share with you all too is just like the start of like the timeline of, when this goes into play. These are the things that we've got, started here. But we also have some other things that we want to get on that as well. As just talking to Terry a little bit about the Optimist Club, making sure we can get out there and have some conversations. I know the Lions Club too is something that I really want to make sure I can get out to. Rotaries and other things like that, which are not on this timeline, but I just wanted to let you know there's been a lot of conversation and discussion, and these are kind of the set draft of moving forward. What does some of this stuff look like? From speaking with the county to, the local village and others, making sure we're getting the right posts out at the right time. Everything has to be done, crossing those Ts and dotting those Is all the way through. So just an overview. If you got questions about that, let me know. On the back side of this though, is just a write-up based upon Quarles and Brady. And I stuck the numbers in here from the numbers you saw on the message that Maria kicked out, and I think it was in the board packet as well. But just showing you what this could look like. Want to get your eyes on this, want to get some feedback. I don't know if we have to have some conversation about those numbers too, so you can see why those are what they are, but this gives you a little sense of what the language would look like.
I just had a couple quick things.
Sure.
There was a schedule you had shared out earlier in the year that had a few things that aren't on here, but, so I guess what I'm thinking is, we're gonna be doing this again, right?
Yeah.
So if we can develop a playbook here that has the schedule all the way from the initial discussion.
Oh, okay. So you want it all the way from the beginning through so that we can give that blueprint to somebody else or to us again, you know, if we're.
5 weeks or something like that,
Yeah.
like week 1 and then just
Yep.
work through. Okay.
So, and there was just a few things on the earlier one that aren't on here, but I mean, this is gonna be an ongoing thing, so
Yep.
whatever, I don't know how many of us will still be around
Right.
next time, so that will play
Well, that's-
both for who's ever coming next would be great.
That's great. Thank you for that. I can
And,
drum that up for sure.
it says there'll be a presentation shared with the staff on the 19th,
Correct.
so.
So that's the morning of that, when you all, okay, here's another invite for you. On the 19th, we start breakfast at 7:15, the Horseman Commons, the cafeteria that you just saw. We go from there at 8 o'clock into the auditorium. At 8 o'clock in the morning, then I'll start a welcome back. In that welcome back, there will be components about the referendum in there in terms of like sharing how this is gonna go, like the narrative, some of those pieces, just giving them a heads up on what this is so they're aware of it first.
Yeah, I guess at some point I'd like the board to get a peek at what that presentation is gonna look like. I'm not
Sure.
sure.
Well, it was what I shared before in the past in terms that, I think I rolled through some of those slides, that message of hope and walking through that, the numbers of per pupil in the past. I can share it with you, Rick, too, again, but I shared it a while back.
Yeah, I
Yeah.
sent you the one note about the small classroom,
Yes, and I made those tweaks, so thank you, yes.
and, because I don't know if we've ever gotten a copy to bring with us to look at. I know you've shown it on,
Oh, the slides.
but I'd like to see it.
Yeah.
So I can
Yeah.
think about it a little bit more.
Yeah, and I've got another, like, I put it in a different package slide deck, so it's under Canva now versus PowerPoint, but you can all see what I'm presenting on, so too. I'll send that out to you by the end of this week.
And then I know we've talked about, focusing on the positives during the messaging, maintaining right-sized classrooms and things like that. But I've only talked to this about to a handful of people, and I get the same question every time: what happens if it doesn't pass? And I'm not saying we have to broadcast that as
Yeah.
part of the message,
Yep.
but I think especially as you go into these meetings, we should have some answer to what happens if this doesn't pass. I mean, it's significant impact on, I'm guessing, the number of teachers, class sizes.
Yeah.
So I think, and I know Steve has brought up the valid point, not to maybe sell this thing. And I don't necessarily think it has to be part of the main presentation, but we should have it in our pocket so we're all saying the same thing about, this would be 10 teachers or whatever it's
Well,
gonna be.
if you read through the presentation and you see that, 75% of our budget is salaries and fringe, and then we're talking about that mainly in this area, that's where it's gonna come from. We've reduced every other area, like from transportation to energy to, these, even insurance for that matter. That's the only other location you can really take from. Now, guesstimate about how many, I also don't wanna scare people to that first day when we're coming back, but just say the next step is potential, like looking at, our staffing.
Well, and I don't know the exact numbers, but like in the second year of the thing, we're asking for 2.5 million.
Yeah.
Well, that's what, 20 teachers or 15 teachers?
Yeah, and then part of that is also insurance increases, transportation increases, and some of those other things. So I think you gotta whittle that out of there too.
Without it, that's what I'm
Right.
saying.
Yeah.
We should have something like, say, friendship will go from class sizes of 24 to 32 or whatever the numbers would be. And again, Steve has a very valid point, not to negative preach, but I've been asked that question 3 times. And I don't know how to answer it.
Yeah, well, just kind of clarify, what I meant by that too was not hitting them with that. You gotta pass this, people, or we're gonna cut their music program, or we're gonna do this as our lead.
No, I totally agree with that.
Okay, yeah.
Well, and the thing is, like, the infrastructure that has been approved and we just had a chance to see its size to a certain, like, to accommodate the way things are and maybe some growth or whatever, but, then you start cramming more people into it, I don't know, just, then you'd have underutilized facilities, yet overcrowded rooms potentially, so,
We're talking about adding 66 students by the end of the referendum, so too fair number.
right?
I think the other case from my experience in the other referendum was motivating the school age parents to get out and support it and vote, and which, I don't know what our percentage of age is for voting, but, tend to be young adults are, a lot less motivated, I think, than older adults in voting who don't have kids. So the ones that have passed, including the first couple that were very surprising to me, was motivated by that grassroots thing among the parents that got out and, so as long as we don't forget about pushing them and focusing on them, we should be good.
At the end of this ballot question, if you look at where it says for non-recurring purposes consisting of operational and maintenance expenses, including for continued safety, current programs and services, and to operate additional space. And that kind of alludes to what you're saying, Jacob. That's to make us be able to do that at what we have right now. That's the ask. And again, that comes back to, we're asking for what we need. We're not asking for bundles of more, right? And I think that's a really powerful narrative in this too. Like, this is where we're at. And a lot of it comes down to, whatever way you want to say it, but our per pupil per state, for the state is not enough with the inflation costs that we get. And we can go there because I think everybody uses that as well, for the reality of it, but it's hard for people to sometimes understand that too. So, but it's pretty simple when you're only getting X amount of dollars and it's this amount to actually run this whole, area at, just at cost.
Yeah, I think there is a little bit of a misperception that while the school district gets a ton of money from the state to operate and all of that, certainly gets some, right? Like that's how it, a lot, but it's not enough to cover the increases in the costs that have occurred. So, I don't know how to phrase that in a way that makes that point, but I think it is a valid point. Like the increases have not been, coming at the same from the funding side.
It's a fact.
So,
Well, I think and I don't know if this just changed, but the 1.1 million in savings doesn't mean we haven't taken an opportunity to correct some of it. Right? So I think that's a message too. That we, the things that we've looked at, we found savings to still provide safety, still provide current programs and services and operate our additional space. But, things got more expensive, and unfortunately the revenue hasn't come in yet to match that.
And we'll have some visuals out there too that will show that. They'll show what the district is and what our funding is and compared to our costs. So there are some good visuals out there.
And we're working with FAIR too at the same time. So there's going to be that plug back and forth with the financial part of it, and getting to a specific number. We can do that like in staffing, but
Not just an estimate, not
Yeah.
a specific number.
Yeah. Okay.
Approximation.
right.
Sir?
Everybody's throwing benefits to all that. I mean, I'm
Yeah.
not looking for an exact number, just.
Yeah.
You know, our class sizes might go up by so many percent or something, I mean. But it'll be a significant, if it doesn't pass, I got some serious discussions ahead of us.
Right. 100%. What's been I mean, in your conversations, I'm just curious, like you said, Rick, you know, that last question comes up and
It's not like I said, I haven't talked to a ton of people, maybe 5, but they're not happy, you know. I mean, I think the people I talked to will vote for it, but it wasn't an automatic, you know, yes, it was, I get to move over this thing, so.
Yeah.
But you have to walk them through it, and by the end, everybody's like, I guess we gotta do what we gotta do. It's not like, automatic, we're in.
Right.
Yeah, I think what I've learned, I think the education piece is what the next month or 2 months, 3 months, is probably gonna be important to share all those things. And I would even say, even though we have made 1.1 million in savings, like what else can we look at? What's our plan? What's our accountability, right? As we continue to find new ways to save money as well. Like maybe we share that. If there's additional, I know the administration's doing a ton, but I think that's an important piece too, is this is asking for what's needed, and there's continued efforts going on behind the scenes to save wherever we can, still provide the same things that are on this question.
And that gets back into that conversation, how specific you get with savings, because I mean, we can be very vague. Like we've looked at transportation, we've looked at energy, we've looked at, you know, insurance, all those things. We've made adjustments to get that 1.1, and we're going to continue to look at that in the future years. I mean, that's how we have to do our business. We know that this is your money that we're putting into it, but we also know that in order for us to run what we have right now, we need your support too, because it's not coming from anywhere else.
Well, it's an investment too in the
Yeah.
community. I mean, everything the community's done so far has been an investment not only in our kids that go to school here, our district, our community. You talk about it, one of the biggest employers, right?
I don't know what property values have gone. It'd be interesting
Yeah.
to find out what property values have increased in the last 3 or 4 years, because I'm assuming it's a lot.
Yeah.
And a lot of that has to do with the school.
People want to be here, right?
It is. And again, everyone's gonna see that next week, their investment for the last referendum.
Yeah.
It's like brand new schools, you know what I mean? So, good facilities, good teachers.
Any feedback on that ballot question from what you see there? I mean, and again, this is given, you know, based upon the numbers Maria shared with y'all. That's what we had there.
It just has to scream what we need.
Mhm.
You know what I mean? Like, the numbers are gonna, the breakout 1.9, 2.5 each year, the difference, that kind of tells the story already. It's not the blanket piece, and that's the key, is we're not asking for more than what's actually needed
Right.
after,
Right.
you know, budgeting out.
We don't actually write the question on the attorneys at Carlson Brady do it.
Correct. I mean, this is what they're doing, but there's language in there, like, you're not gonna be able to use whatever language you want.
Yeah,
I mean, this is the
right.
language we got from legal saying like, this is appropriate, but I just wanted to make sure that we were getting the right.
has to come before anyone
Yeah,
lays eyes on it.
Oh, right, exactly.
Somebody's not decided by the time, no matter how you word it.
Yeah.
They haven't decided. It's gotta be no.
Yeah.
So they have
They're just gonna look at the
to
referendum question. It's the what do I wanna select, knowing what they know then.
So on that document that I sent you, the assumptions are down below in yellow. So it's showing that rather than the 2 staff members that we had originally talked about, this is just adding 1 new staff member per year, if it's needed. And then it's also assuming a $500,000 decrease in insurance plan design. So that's all of the, you know, it's a portion of what we talked about earlier.
That 500,000 is for next year, right?
It would start this year.
24.
25, correct.
Yes, yep, but I only took 250 of that, 250,000 for this year, because we're on a fiscal year and the plan is on a calendar year. And then one other thing that I wanted to talk about, it was, Matt and I felt very strongly about having the increase which is, our mill rate last year was $8.15. We felt really strongly about trying to keep that first year increase to less than $1. So, what I did then was, we have a fund balance in our referendum, Fund 39. So where we have been over levying, we've built up $300,000 there. So what I'm proposing or suggesting is that we spend that $300,000. So we under levy now by $300,000. So it's gonna look like, on the budget, it's gonna look like we aren't really covering our expenditures or our loan payments, but we have $300,000 sitting there. So, and that's a 36-cent difference in the mill rate. So it would have been $9.47 if we didn't do that. And instead it would be around $9.11.
What's that used, sorry, the Fund 39 one that you're pulling, what can that be used for otherwise?
Only to pay debt.
Okay.
Yep.
I think that's a good
Yeah.
decision then.
And that's the potential, like, if it doesn't pass, like, that's the one we're gonna have to over levy then, right?
We don't have to, but
But,
that's
well,
what
I mean,
we've
it
been
would be,
doing.
it would be an avenue to have access to some funds, right?
Only we can only spend it on referendum, so only on debt.
On that debt.
Yes, yeah, so we can prepay debt later, we can defease,
Okay,
which is what we did with our last referendum.
But we could that would keep the mill rate up, so that if we came back later, you wouldn't see
Right.
that big jump.
right.
Right, that's kind of been the strategy here.
I noticed, it seems like the salary increase percent went up from last time. You know, going along the years. Like last time, well, like once you get to 26, 27, the salary percent increase was 3.21, now it's 504.
Mhm.
And the 3.32 or 3.22 to 5.6. And last year it went from 3.2 to 6.1, which is probably realistic. I'm just saying that was a change.
Yes, that was definitely a change as we're hiring and as we're forecasting. Yeah, and a lot of that is that new staff member, because we get one in 25, 26. The next year we'd get 2 more, the next year we'd have 3 more, so it's compounding.
And then what I still don't quite get is the benefit increase percent goes down and it's actually negative the last few years.
That's having to do with the insurance costs, so that savings,
And we're talking about
so it's actually.
after at that point in time,
compounding as
over
well.
the course, that's the projection that will come out.
Is that saying that from like for 2026, 27, 27, 28, our benefit cost is gonna go down 1.59?
It should, yes. It should,
That's based on factoring in the $500,000 in insurance and
yes.
plans, okay.
I have to think about that for a while. That doesn't make sense to me from year after year going down. So we're saying our benefit costs are gonna go down from the year before. I don't just-
The increase, yeah, I mean, we're hoping that it will stabilize, that's the plan. And
'Cause
that's
it went,
how I have it built in the budget, is that right now I have it at a 15% increase and then the following year at a 10% increase, but I've backed off $500,000, so it's showing these decreases now.
Okay.
And we can talk more about it, Rick, if you,
Yeah, I just.
if you wanna digest it and then-
Yeah.
sure. Any other questions? I mean, every line, there's the fund balance percent, which it is going down. There's a very good chance that we would have to short-term borrow for just that month, that first payroll in December, or that last payroll in November, actually. And, but I would do a line of credit and that would get paid back right away. So it's a possibility. The thing that we have factored in some growth here with students. And, that's based on a model as well. So that could be up or down. Yeah, any other, and the other thing that Matt and I thought was important was that last year, that 5th year, the mill rate would stay below $10. So that was our goal.
And that was different when we had the
Mhm.
initial, like even when you saw some of those other ones. So I feel like that levy, or the mill rate, excuse me, over the course of time is palatable. And I think it's much better than it was in the beginning because we were flying in the 1046ers or even 11s.
Yeah.
Again, trying to keep that below $1. And then from year to year, you're talking 20 cents. And I'm not saying that isn't a lot, but it's far less than what we were seeing before. It was close to 40 or, 50, cents on the, so I think with some of these adjustments and changes, I think, again, it's meeting that conversation. We're asking for what we need, not asking for major excess.
So, okay, this might be a silly question, but the original, did we already have 800,000 for 24-25 school year?
Yes.
That's what we had.
So-
This is the last year, and then it falls off after 24-25.
We're actually asking for 1.1 million.
Yeah,
above
that's
that.
what I was gonna say. Does the question need to reflect that? Because we're already approved for
Yeah, that's a
800,000.
good question. That's a good question for
Yeah,
Allison.
I think it would just be 1.1.
Yeah, that's a really good point.
I didn't-
Good catch.
Oh, yeah.
Okay. Any other comments, clarifications, discussion on this right now? Okay. Again, more to come. On the 26th, we have to vote on it. It's gotta be go, because the next day, that's where everything starts. The 27th is the 26th is kind of the last day we can actually do it. Then the 27th, we go full throttle into that process and kick it into the county and everybody else. So it's gotta be ready to go.
We don't have a problem with getting quorums, but we gotta make sure we get at least 3 members that
Yes,
are here.
yes, on that night.
Stay healthy.
Or zoom in.
Yeah, amen, we're zooming. Okay.
Awesome. Thank you, Maria. All right, our next item is discuss potential policy participation in political activities, which is in our board.
Yeah. So I'm throwing this out there with the eve of elections on the forefront. I just want to make sure our staff is supported and that we have language that will take care of them in the work that they do every single day. And what I've seen in terms of what our current language is as a district towards this, let me see if I can fly to it, is more of a general component. But I did find a little bit more specific in a guideline from the administration level that can pinpoint, and we can go a little bit deeper with it without writing a whole bunch more. I included like the Appleton School District because it gets pretty like specific in terms of activities permitted, activities not permitted, political discussions during instructional time, really have a balanced view and review of major candidates, because social studies 101 or even not social studies 101, you're going to be, when this starts happening, at least at the high school level for sure, there's going to be conversations and discussions, and you've got to stay very, very balanced as that educator. The minute you start slipping in one way or another, and then, someone goes home and says, hey, Mr. Mino said this or that, I don't know how much we can do to really help you too much, and then we're in an investigation state. So I'm just looking for more feedback. I think instead of going to changing specific policy, I think there's enough in the administrative guideline that I just found like a couple days ago before I kicked all this out to you, or after I kicked all this stuff out to you. So I think there's enough to like clarify that with staff, even on that first day, just being, hey, just want to give you a heads up. This is part of like what we have within our policy in terms of administration guidelines, but just as a heads up that, you know, this is coming amongst us, and just be very mindful of what we say, what we do within the frames of our school. Now, what you do outside of here, like on non-grounds, or you put on Facebook or social media, that's your own. Like that has nothing to do. If you're doing Facebook or social media during school though, and doing that, it's a whole other good story, right? So I just want people to be thinking about this because, again, I've lived through a few of these general elections, and it can get a little bit dicey with just, you know, how things can go. And that's for anybody who's ran. So
The only thing that I had hesitation about was from the Appleton thing on the second page, I guess, so it'd be that first section, activities permitted, C.
Yep.
Wearing a partisan button or
Yeah.
or t-shirt or shirt
Yeah.
by a staff member. Seemed a little iffy to me, but I don't know what everybody else thinks.
Yeah, agreed. It's kind of communicate, I mean, not,
It's like saying, if you have a sticker on your bumper voting for this, is that against, should I have a, bumper sticker on there? And I don't.
See, a bumper sticker doesn't bother me as much because then the kid has to go out and see.
Right,
what's on it.
right.
Most hard is where I'm wearing a shirt or a button in the classroom teaching.
You're definitely showing your
That seems a little.
stance.
tough to be balanced when you're.
Yes.
Right, you're speaking it only by display rather than by verbiage.
Right. And a lot of this came from like Act 10 too, when that came out, when, obviously there's a lot of individuals upset with the changes that were being made in the government, and there was people started wearing these buttons and we're like, you can't throw that in front of people right now. So I'm not against like saying that, because I think it does start showing how you're biased then indirectly through wearing a pin.
Right.
Or putting posters up in your room, or, those are all those things that you gotta be really mindful of.
Mhm.
And then this can go into a whole different direction too. If you keep going down that road, like, if you put up certain posters that have certain like specific meanings within our country, Black Power, whatever it might be, is that right? Is that appropriate? But those are strong conversations. I think you're right. I think just saying like, don't go in that direction, it'll keep you safe. We have way better support and ways to keep you out of that world within that. Put the button on after school. Like, it's not worth it.
Exactly.
Right.
It really isn't.
Yeah. It's just-
And that's gonna be kind of my message, like in the beginning, just like, it's not worth it, folks. Like, you don't want to go down this road.
Right. I mean, you're not gonna be able to avoid conversation, but to your point, if you can just make sure that it's balanced and.
Right.
You're not, putting anyone at,
And most people understand that. Most people get this.
Mhm.
However, though, in the heat of things, and like when things are in that room, sometimes you slip, sometimes you say something, and that's all it takes. But we want to be able to defend, and saying like, hey, that can't be an everyday, or like, I'm bringing this button out and showing this. I mean, that's going to be a clear whistleblowing for a lot of people to check out. So I just wanted to have a conversation with y'all that we're going to be talking about this. So we're trying to keep our staff and support staff safe in the balanced, instructional way of doing it.
I have a problem with, and all the other pages I thought were fine.
Mhm.
We may, at some point, look at getting more specific like this. It's really pretty general right now. It doesn't mean that we can't have this conversation like I'm having right now, saying, avoid buttons, be mindful of some of these things, because you're a billboard, people are gonna see that. They can definitely say that you're favoring this one way or another.
And the more you write down in the policy, that's more specific, the more times you
Right.
can get yourself caught. in the
Absolutely,
corner.
Steve.
So-
So that's another conversation I want to have here too, is like, the more we get entrenched in those specifics, well, what about that? What about this? What about that? And before you know it, you're in a whole different world too.
Good to keep it general and do it on a case situation.
Just giving you all heads up. This is, I want to be cognizant of it as a like leadership in terms of that, and making sure people are aware of that. So we're mindful of that when we get into the classrooms here.
And because, you know, honestly, kids can wear what they want to wear. Like if they want to wear this hat or this button or whatever, they can. Like, unless it's causing harm potentially to themselves or others within that, or it's a distraction to a point where the learning can't exist within that classroom.
Right.
And then it's the conversation with that child and saying like, okay, do you understand why this is and what we need to do? And that's a tough conversation at times, but you got to have it, because if that disruption's happening, we have the right to say like, that can't be used at this particular time. But then they'll say, can I wear it in the hallway then? Well, yeah, as long as you're not hurting other people within that frame, so. Okay. Thank you. I just want to quickly go through that.
All right. Our next item, we have new business. We have 3 items on the agenda. So the first one is consider approval of the 2024-2025 student handbooks. So I don't know if there's any questions or conversation, otherwise I'll look for a motion to approve.
This is all based upon our last, meeting.
So moved.
Second?
A roll call?
Matthew,
Yes.
Humphrey,
Yes.
Geckerman,
Yes.
Yes.
Yeager, yeah.
Alrighty. Second item, consider approval of 2024-2025 co-curricular handbooks. Again, discussed last meeting. So
There's only one thing, it was an update. Terry asked about that senior award and why that was being replaced. One, keeping track of all those individuals and making sure like every single year, there's not a good accurate, this is from Jillian and from Dwayne, there's not an accurate level of whether or not these are doing it, because that hasn't been kept up for a while. 2, they said like, we're giving awards at every single level in different ways, so we don't feel like that's a necessary thing to keep, putting out there. They're getting recognized in other ways, so those are the 2 reasons why they shared with me, so.
Any other discussion? Otherwise, look for a motion to approve the co-curricular handbooks for 24-25. I'll make a,
So moved.
a second. Roll call.
Matthew,
Yes.
Geckerman,
Yes.
Yes.
Humphrey,
Yes.
Yeager, yes.
Alright, our final item is consider approval of vehicle loan not to exceed $30,000 at the rate of 5.5% for 4 years. Is there any?
I don't know if we want to talk about that, Dave too, I mean, we're just trying to.
So we're looking to replace the first vehicle I bought when I started here. It's a 2010 van. It's in rough shape. Rusting through pretty bad, where we babied it through the last year and a half. This time it's not safe anymore. I've been looking for something to replace it with. I found a truck that fits our needs. It's a 2020. Fairly decent price, no mileage, so I'd like to do that.
What's the primary use of it?
So we use that in maintenance. So we have 2 vans that we use in maintenance. One was for food service. We're no longer hauling that, but we have to help Chartwell's out a little bit this year. So we're gonna be using the new van with that for them. We'll be using it when they're not using it.
Mhm.
And then the other one is what Josh uses for most of his outside ground stuff. The biggest thing is that we needed a covered vehicle because we carry the salt and stuff for winter when we're salting. So not getting that wet really makes it nice the next snow. We're out there in the bad weather, so.
Yeah.
Back when I first started here, the reason we bought the first van was, we replaced the van, but the second vehicle was they had a 2-wheel drive pickup truck that they didn't drive all winter long. It was just the purpose when it shouldn't have been there,
Yeah.
We're out in the bad weather, not the nice weather.
Look for approval to, for the vehicle loan not to exceed $30,000 at the rate of 5.5% for 4 years.
So,
Second. And then roll.
Yeager, yes. Humphrey,
Yes.
Matthew,
Yes.
Geckerman,
Yes.
Yes.
That concludes new business. We are then gonna need a motion to go to closed session.
So moved.
A second. And roll call on moving to closed session.
Matthew, Geckerman,
Yes.
Humphrey.
Yes.
Yes.
Yeager, yes.
All right, excellent. We're in
All right,
closed.
everybody. Have a good night.
Thanks, guys.
Yes, thank you.